It is licensed practitioners who are not being allowed into the system to make the prescriptions. Once the prescription is rendered by a licensed practitioner, it has to be funded under EPSDT. So the grand scheme here is, don't let them prescribe it. Do whatever you can to co-opt the prescribers. Don't let them enroll in Medicaid, drive them out of Medicaid, in some way control the prescribers. Because if they're not prescribing it, or if they're prescribing an hour a week, what can we do? This is obscene. It's an access issue. If a child's entitled as a civil right to funding that is sufficient, and you have a scheme created that makes believe that it's not necessary, that literally flies in the face of the National Academy of Sciences, the American Academy of Pediatrics, and other non-co-opted authorities, and you allow the state government, the county government, or the insurance companies to only permit those people to prescribe services, you're creating an access issue. And that's what EPSDT prohibits. That's why your only hope, you can't go to the local insurance company. What are they going to say? They're part of the problem. You can't go to the county government. They're part of the problem. You can't go to the state. They're part of it. It's this melange that is self-serving, and they're making stories up that it doesn't work, which are not true. If it's done professionally, if it's done with oversight, with parent feedback, it works better than any other intervention imaginable. By suppressing that knowledge, by only allowing certain providers, prescribers, to prescribe it, they create the illusion that it's not necessary. And by that means, everybody suppresses access to treatment. That's my contention. I'm seeing evidence throughout the state of Pennsylvania about it. You, ma'am, you're a provider. You know it's happening too. I have a case number at the Office for Civil Rights. All you have to do is call me, and I'll give you the case number, and you can submit evidence statements. I put that call out to the Autism Society. I put it out to all the advocates that I know. Put it out to all the advocate lawyers. Please, I've got a case. Send in. There are some parents who are extremely well connected who just told me yesterday, what do you mean you filed a complaint? Had no idea. Nobody told them. So it's not just the state that's concealing this, or the county, or the insurance company. It's the advocacy community itself.
Why?
If part of your funding comes from the state, or the county, or God forbid an insurance company, you have a vested interest in not rocking the proverbial boat.
But it's not just that.
What else is it? Help me understand this.
It's fear of retaliation. It's fear of
Okay.
what's going to happen to your
Well, okay.
And families are afraid that they're going to lose what they already have because maybe they'll change the laws and do some things like, for instance, taking away the free access to it by putting caps on and putting co-pays and stuff on this stuff, all that. I just talked to a lawyer from DRN who has a suit against the state around some services under VHRS. She can't get, it's out in the east, she can't get providers to give testimony, they're afraid. And she said, they tell me stories behind, but when I ask for something specific, they go, oh, no.
What they're trying to do is carve out applied behavior analysis from within BHRS. And they're claiming in this suit that the state somehow doesn't allow applied behavior analysis.
Well, not that they don't allow it, they don't, that they have not did their due diligence to make sure there's enough of it. That it's there and available for people to use. But there's another suit too, as a matter of fact, it was for kids with ADHD and it wasn't around applied behavior analysis. And again, they're having trouble getting people to admit the problems that are there. And I understand.
It's a climate of fear.
It is a climate.
All right, so I'm in the climate too, and I'm standing up and saying you don't need to be afraid. Your fear, your terror, oh my God, they'll throw us out of the network. Well, if you need...
That's not only it, a lot of them are afraid of the fraud, waste, and abuse things that come down. They're afraid of excessive amounts of scrutiny on everything.
Of course.
The details, and a lot of the agencies can't afford that kind of stuff.
And what we're talking about is the deliberate, intensive use of intimidation to suppress access to treatment. The solution is talk to the Office for Civil Rights. Join the civil rights complaint. Tell the truth. Tell people what's really happening. Standards have to be created by the state Medicaid agency within the purview of federal law, not created by an insurance company that can institute these kinds of cruel and abusive investigative practices. I've heard from some practitioners in the state who've been telling me that, yeah, they did our audit, and they're trying to say that we don't meet their quality standards. They want us to have 75% of our contacts face-to-face rather than any kind of like where you write a treatment plan in an office. That's all legal, it's all permissible, but the insurance company is saying no, 75% of your contacts have to be face-to-face in the family's home. They got it up to 98%. And the insurance company says, you're still not meeting 100%, and we expect 100%. You shouldn't be billing any of these non-face-to-face contacts. And the poor provider says, where does it say that? Well, that's our standard. So now an insurance company is literally writing policy, enforcing it, while the state Medicaid agency is sitting back patiently waiting for BHRS to destroy and disappear. That's just wrong.
That was brought up actually to the state, and they said, oh, managed care companies are allowed to put their own expectations for performance, not for medically necessary, but for performance, and we can't, that's up to them. We can't.
I know, they've said that. They are supposed to make policy. They are supposed to say what is medically necessary and what is permissible because they are the state Medicaid agency. An insurance company is an agent for them. For them to abdicate responsibility and say, that's up to your insurance company, is, in my understanding, and the understanding of some of the lawyers who have come now out of the woodwork, who are talking to me about civil rights issues, they're saying, yeah, you're pointing out that the state Medicaid agency has abdicated its responsibility as a policy-making and enforcing body, ceding their authority to an insurance company that has a bona fide vested financial interest in reducing the delivery of funds for EPSDT and behavioral health services. So it's a dreadful situation, and the only hope we have is that other providers realize how dire the situation is and send evidence to the Office for Civil Rights that corroborates what you're telling me is happening. We can't sit by and hope that some lawyer filing a lawsuit in federal court is going to save us. Nonsense. The only hope we have is that the Office of Civil Rights comes in and says, you can't do this anymore. Put reasonable constraints on, make licensed professionals responsible for the oversight of treatment, establish minimum standards for outcome measurement and reporting, and do all of the things that you're legally allowed to do. But don't let insurance companies impose these ridiculous standards. What place on earth expects 100% compliance with relatively trivial demands? Thank you for coming. I hope you'll contact me and we'll work together.